Okay, so first thing, I'm going to verify my healthcare provider's orders, and I'm just going to do that by reading the scenario on the MAR. I'm going to go ahead and wash my hands. I have verified my healthcare provider's order, so I'm going to gather my equipment for trach care and suction. So I have my suction catheter kit. It is unopened, intact, and unexpired. I have my trach clean and care kit. It contains the normal saline and the hydrogen peroxide already in it, and it is unopened, intact, and unexpired. I have my bottle of normal saline, and I'm going to go ahead and do my 3 med checks on it. This is sterile 0.9% normal saline, 250 milliliters. It is unopened, intact, and unexpired, and I would say that exact thing 2 more times. I have 2 pairs of sterile gloves that are both unopened, intact, and unexpired. So now I am ready to go into my patient's room. Hi, Mr. Pelvis. My name is Abby. I'm going to be your student nurse for today. I would provide privacy and wash my hands. Can I get your full name and date of birth? He says Elvis Pelvis, 5'1", I would check that with his ID band, Elvis Pelvis, 5'1", I would check his patient ID band and patient number 402702676. I would check that with the MAR, and it says 402702676. Alrighty, Mr. Pelvis, we're just going to do some trach suctioning and care. You may cough during the suctioning, but that's encouraged and it's okay. Is this okay with you? Yes, it is. Okay, great. So we're going to go ahead, raise the bed, and I would check to make sure that there is a spare inner cannula and obturator by the bedside, which there is. I'm going to go ahead and put you into my Fowler's position, about 45 degrees. Lower the side rail. Okay, so I can see that you're a little restless and your O2 stat is about 90, is a little low. Your heart rate and blood pressure is a little increased, and your breathing looks kind of labored, and I'm going to go ahead and listen to your lungs. So every time I move my stethoscope, just take a deep breath for me. Okay, I'm just going to check your back lung sound. So I heard some crackles and some adventitious breath sounds. So it sounds like you do have some secretions in there, and when you cough, I hear them. So we're going to go ahead and proceed with the suctioning. Is that okay? Yes, it's okay. Alrighty, so I'm just going to turn up your oxygen to 100%, 10 to 15 liters. And I'm also going to set up my suctioning. I'm going to attach it to the wall and set it at 100 to 150 millimeters of mercury and set it in close reach. I'm also going to unsnap his oxygen collar so it's easy to remove. And now I'm ready to set up my sterile field. If I thought that I needed a gown, mask, or goggles, I could put them on at this time, but I don't think we'll need it for this patient. So I'm just going to take my trachea away. So first I'm going to open my suctioning kit. I'm just going to use this as my trash. I'm going to go ahead and slide out my normal saline box and making sure that nothing touches the top of the box. Go ahead and open it. I'm going to take my bottle of normal saline, open it, making sure that I don't touch the top of the bottle. Go ahead and pour that into the box and throw that away. I'm gonna go ahead and open my suction kit. And now I'm gonna put on my sterile gloves. Pick up my first glove by the cuff. Scoop up my other hand. Alrighty, so now I'm sterile and I can pick up my catheter. I'm going to go ahead and wrap it in my dominant hand. And now I'm going to break sterility with my non-dominant hand by picking up the suctioning tube and connecting it to the catheter, making sure that I don't touch my sterile glove to the suctioning tube. Alright, I'm just going to check the patency of the catheter, putting in the normal saline and suctioning. Good. Alrighty, Mr. Pelvis, we're going to go ahead and start the suctioning. So I'm going to remove your oxygen mask. And I'm going to go ahead and insert the catheter. I'm going to go until I meet resistance. I've met resistance, so I'm going to pull back an inch. And I'm going to start suctioning now. I'm going to twirl my hand, the catheter, making sure I'm not in there for more than 10 seconds. Take out the catheter, put back the oxygen mask, and I'm just going to look at the amount, color, consistency, and odor of the secretions and note those. Just going to clean out the catheter in the normal saline. And while we wait a minute before I do my second pass, I'm going to reassess his respiratory status. So his O2 stats have gone up a little bit. His respiratory rate is a little lower and he doesn't look as restless. His breathing is a little bit better. So it has been a minute and we're going to do the second pass. So I'm just going to remove his oxygen mask. Mr. Pelvis, I'm going to go ahead and insert the catheter. I'm going to go till I meet resistance. I've met resistance, so I'm going to pull back an inch. And I'm going to start the suctioning now. Twirling the catheter, making sure I'm not in there for more than 10 seconds. Take the catheter out. Replace the oxygen mask. Again, note the color, amount, consistency, and odor of the secretions. And go ahead and clean out my catheter. And now I can be unsterile and remove the catheter from the suctioning and throw away my equipment. Remove my gloves. Wash my hands. Go ahead and reassess his respiratory status. So your O2 is back up to 98, which is good. Your respiratory rate is 12, and your breathing looks unlabored. You look a lot more comfortable. So at this time, if it was necessary, I could perform nasal or an oral pharyngeal suctioning, but I don't think he needs it right now. I can go ahead and turn off the suctioning and wash my hands one last time and get ready for trach care.